call the meeting to order. Everybody please rise for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, next is reading of the mission statement. Sharita, please.
Our mission, Macomb County Community Mental Health. Quality services which promotes recovery, self-sufficiency, and independence.
Thank you. Item number 3 is adoption of the agenda. I'll take a motion.
So moved. Support.
Motion by Megan, support by Antoinette. All in favor?
Aye.
Any further discussion? Okay, motion passes. Item number 4, hearing of the public. I don't think we have anybody except Drew. All right, maybe somebody will pop in before the end. Okay, item 5, request to approve. Item 5A, request to approve the Jefferson Wells Statement of Work for the Medicaid Verification Audit 2026. Total not to exceed the amount of $418,760. I'll take a motion.
Motion to approve. Support.
Motion by Antoinette, support by Sharita. Helen?
Yeah, thank you. So you may remember we do a billing verification audit each year of our provider network, including our direct operated programs as well. We've been using Jefferson Wells for many years now. We still put it out for bid every so often, so we're in year 2 of a 2-year bid cycle with them, so they're already under contract with us. And so for this year, they're going to be performing our audit for mental health substance use services. And they came up with their statement of work amount to be the amount you see, $418,760. And just looking to get approval to agree to that amount and let them commence the process. So it'll start, we've already met with them to start the planning. And then letters will go out to all the programs to let them know when the audits will be occurring. They do a lot of it remote because many of the records are available within our electronic medical records. For those that aren't, they have them uploaded in a secure file for that. And then throughout, they'll check in with us and give us updates on how the audit is going and where things are standing, or if there's any issues coming up they want us to help clarify. And then at the end of the audit period, they will give us a wrap-up information on it and provide us with many reports on each program, all the items, if there were any monies that they're recommending that we, bring back because they weren't done appropriately, all that type of detail. And then we take all that information and we present an annual report for the state.
Ellen, any questions? Go ahead, Donna.
Did we get a copy of that report, or I don't remember if we ever got a
I
copy?
can't remember if we do.
We might at a very high level, I don't recall, and I can clarify that, but you wouldn't get the detail because it's like
Yeah.
an astronomical amount of data and it's very specific person identifiable data. But at a higher level, right? Like
We
the
have
number of.
We have more of a condensed report that says, did we meet these elements the state requires us to do? They verify that. They address our sampling size pool, met the requirement, and then we get a total dollar amount of what we may be recouping.
Yeah, maybe you can let us know if we get like a higher level.
Yeah.
I don't remember if we got one or not.
I think,
We do usually get like an overview.
Yeah, I think an overview.
yeah, and if it's
Yep.
helpful, do you remember Chandra came, I don't remember if it was last month or the month before, she was the compliance officer. In her annual report that she presented, it does have that as one of the line items or whatever. It's to demonstrate that it's a required outside activity that is there. That's also what she used to provide you with, this is not the right terminology, I'm gonna call it error rate, right? Like, in other words, how much of this many $1 million, what was that and what's the take back amount? So it's referenced in that report. It's just not called out as Jefferson Wells.
Like how many records were out of compliance and.
Yeah, it's just gonna give you, and to be fair, it's a very, I don't remember the amount, but it's at the error, and again, it is not called an error rate. I'm just simplifying it in terms. It's often minuscule, in comparison, yes.
Yeah.
Okay, thank you.
Nick?
Yeah, this didn't note that whether or not it was approved by legal yet, as it going through the process, or,
Yes, yes, but Nick, just because Nick is a rock star at finding things, I mean that as a compliment. He did find I really do mean it as a compliment, right? There was a minor word in there that could be misled or misconstrued by accident to them, so we are getting with the,
so
them to
Drew's
get
gonna
that
see, yeah,
corrected.
I'll talk to him about it later, yeah,
Yeah,
no problem.
and we always welcome.
Well, as long as we get the corrected by the time we get to full board, that's
That
fine.
would be the goal, yes, sir.
Okay, thanks, Nick. Any other questions? I have a motion and support, all in favor?
Aye.
Any opposed? Motion passes. Item 5B, request to approve an additional $31,000 for Jefferson Wells to support the expanded scope of the Medicaid verification audit for 2025 for direct and DCO providers. This has been approved by legal. I'll take a motion. So moved. Support. Motion by Megan, support by Antoinette. Helen, you're up again.
Thank you. So we're actually going back to last year's completed audit. And last year, we changed how we had things done on the mental health side of the audit process. So originally, when Jefferson Wells gave us information on what they thought the cost of the service would be, we had expanded our pool from every 2 years auditing. So half of our programs would get audited 1 year for a 2-year period, and then the other half the following year for a 2-year period. We said, no, we want to be able to see everybody every year. And so they gave a quote based on that. As we gave them the information, though, the amount that we gave in there based kind of on our end, it ended up being more of a sampling size than they originally bid on. So at one point, this board approved some additional funds for that. So then the audit is going along, and kind of near the end of the audit, we had asked them to break out our directs differently than we had in the past and include our DCO contracts, our direct care organizations under our CCBHCs. So now they had to go and manipulate what they had and change things up some. So it ended up costing them $62,000 extra over the original amount. So we kind of negotiated back and forth and said, how about we split the difference with you, because you kind of estimated wrong. We had a little bit of ownership in it because we could have done a better job of giving you more advanced on this. And so we came to that agreement. And along the way, it did get delayed, kind of in the sense of, it took a while for us to get through that process and negotiate with them and agree to it. And then Tony left. So we kind of had it, nobody remembered that it didn't get forward. He actually created a write-up for this, but it didn't get brought forward. So we're correcting that now.
Okay, thanks, Helen. Any questions? Great, I have a motion and support, all in favor?
Aye.
Any opposed? Item 6, receive and file, we don't have anything. Item 7, other possible agenda items, just some reminders. CMH full board meeting will be here Wednesday, May 27th at 6 p.m. Reminder, there is no June program and budget meeting, and then there will be a full board meeting on Wednesday, June 24th at 6 p.m. here. Item 8, provider comments. I don't think we have any providers. Item 9, hearing of the public. Any board members have anything they'd like to add? I do. Matt?
Okay. So at today's Board of Commission meeting, we did move to approve an agenda item to full board, and we'll vote on that, I think, next Thursday. But I know, Tracy, you're familiar with what the health department is looking to do with the selling of the Southeast building. Because they are redoing the health department, adding on to the Verculen building, and they are going to want to sell the Southeast building, which we are a part of. So I just want to give you a heads up that that is option 3 that they had, and that is the one that is that the board chair is advising that he is supporting, which means everyone's going to support that. So just a heads up, I know that is pretty much,
Just to cut, it'll cause staff to be anxious
Yes.
with unknowns.
Yeah. So just a heads up for Tracy, really not we can't do anything, but because I know yeah, vacation time. So because I know with when the last time we were looking for a building, it's like we kind of found one, but it didn't have all the things, so we had to pass on it. But if
Did they give the timelines?
so yes, and I think yeah. I'm like, where's my seat? So it would be moving. I think with the southeast building, it's not going to move as quickly as the health department, the Mount Clemens Health Department, because that building is actually falling apart. So that's going to be demoed first. But uh, it's saying cost acceleration. It pretty much anticipates it's an approximate 24-month projection. We're gonna vote on it on Thursday, and then from there, they will be moving forward with for for that one, looking at how much they can get for the building, stuff like that. So from what they said today, they will be trying to move quicker, but they're going to start with the demolition of the health department first and then move to the southeast. So I said, okay, that's great. I'm sure, I'm not, you know, I'm on the board, but I'm not working behind scenes. So I'm sure you've been in contact with CMH, and they all smiled at me, which means they have not been in contact with CMH. And I said, don't worry, I'll get a follow up today because we have a meeting right after this. And Tracy can catch me up on what you guys told her. And and we all just smiled at each other. So, but just a heads up really for you. But I know, like I said last time with the building and everything, it's like you pass on something because it didn't have all the things, but in some situations we can't always pass. But I'll keep you updated if they don't. That's it.
Sure, go ahead, Donna.
Yeah, that's at 10 and Harper. That's where I worked for most of my career here. And the 13 and Ryan was closed at one point. That was southwest. And southeast is what services everybody in the south end of the county. So closing that facility gives me great concern because a lot of our clients are at the south end of the county. And that's really what services the south end of the county. And we always were pretty packed down there because that's where everybody from the south end of the county comes to. And we really have a lot of people that we service down there. So closing that facility gives me a lot of anxiety because where are they going to go now? I mean, a lot of them have transportation problems and, we'll have to go a lot further if we don't have a facility in the south end. The south end really needs to have somewhere to be serviced.
Yeah, and that's something that that's something that I brought up, and I know they aren't looking for like probably a year before it would even be sold. So there would be a lot of communication guaranteed between them and Tracy, and then that gives us time to have uh, looking for a building, not us, we won't be looking for the building, but at least we'll be able to see what they find and Tracy can present it to us and we can weigh out our options. But I just say it now because of what happened last time, where there wasn't a bus stop or there weren't the exact things that we are looking for. And like you said, there are a lot of needs on that end of the county. So sometimes we may have to go with the best building and make other ways for our patients in the meantime. So it's just a really early heads up because, like I said, they will be in contact with Tracy, and then that gives us time to see what's out there and what's available.
Rita?
was just really sad that Tracy didn't leave us in committees, like, nothing, just.
I know. It's been very overwhelming lately.
Yes, FYI, we like treats. Nick, did you have something?
Yeah, I was just going to comment, that considering all we went through and looking for a new location at the 15 Mile, and that will now be the southernmost facility, Warren's still the largest city. St. Clair Shores, East Point, Roseville, there wouldn't be anything there. I mean, we have to have a facility before we close this one, and it's not easy to find another facility, so I don't care which building it is, except we have to have something at the south end of this county.
I think we would all agree to that. Now it's just working towards that.
Good luck.
Anything else? Anybody have anything else they'd like to add? I don't see it on here, Tracy. Did you want to do like an update or anything, or we're good?
We are okay. We've been trying to be more efficient, so we have the larger report at the full board meeting.
Got it. Okay, thanks, Andy. Okay, item 10, I'll take a motion to adjourn. Motion by Nick, support by Sharita, all in favor? Aye. Thanks, guys, good meeting.